Hi everyone, I'm Maya from OnePow. We are an organization working on ending the stigma around mental health for South Asians in America. Today we have with us Suneel, a psychiatrist from New York. Hi Suneel, thanks for coming here.
Hi, Maya.
Could you tell us a little bit about yourself?
Sure. I am a psychiatrist, as you mentioned. And then I guess kind of related to the topic at hand and your organization. My parents are both from India. I grew up mainly in New York and trained in New York as well. And I'm now in residency, which I'll get into a little bit later, but I'm in residency now, continuing my training in psychiatry at this time.
Thank you. In our past interviews, we have spoken to therapists. So could you tell us a little bit about the relation between a therapist and a psychiatrist? What exactly does a psychiatrist do?
Sure, yeah. Let me start just first off with maybe, what a psychiatrist is. So a psychiatrist has received an undergraduate degree from a college or university and then gone on to medical school. Medical school itself lasts 4 years. And in medical school, all of the students learn about the different organ systems in the body. So they first learn about these organ systems and how they function normally. And then they learn about what happens when something goes wrong. And after they do kind of this book learning of it, they'll rotate through different clinical settings, like internal medicine or surgery, family medicine, neurology, obstetrics, gynecology, and also psychiatry. So then medical students decide what they would like to train further in, and that is what's called residency, where I am right now. The ones who choose psychiatry go on to train for about 4 more years. It's like a minimum of 4 more years. And so during that time, they gain an intimate knowledge of the human mind, of psychotherapy, and what is called psychopharmacology, or the management of medications. So psychiatrists can actually be therapists also. They just have the added benefit of being able to prescribe medications when necessary. The reason that psychiatrists are the ones that are able to prescribe medications is because they have an understanding of all the different organ systems in the body, like I mentioned before, which is important because medications can have effects on different parts of the body, even if you're trying to target, let's say, only the brain. It's going to have effects on other things, so you need to know about how those interactions can affect people. And then even though psychiatrists can also conduct psychotherapy, many times a psychiatrist will manage a person's medication while they also see another practitioner who is dedicated for therapy. And when this happens, it's always very, very important for the psychiatrist and the therapist to keep in close communication so that they can coordinate what they're doing and kind of thoughtfully discuss what's going on. For some people, oftentimes a person who's been going to therapy for a long time, they actually don't require therapy at all anymore, and they might just see a psychiatrist regularly for medication management. And then regarding overall health, a psychiatrist can often help a person to identify what doctor they may need to see for a particular health issue and help them to navigate the healthcare system, which can be complicated sometimes. Psychiatrists are also needed to write letters in support of services or housing as necessary for people who might require them.
All right, so you talked about medication and how psychiatrists can prescribe medication. How would you discuss the role of medication in mental health with someone who might be skeptical?
Yeah, that is a great question. And for someone who's skeptical of taking medication, the first thing I would say is good for you. It's always important to be skeptical about things, not just to listen to an authority figure who's telling you something to do. You kind of want to think about things for yourself and kind of empower yourself in the decisions that you're making. And it's also helpful in the long term not to kind of look for quick solutions. So I think coming into it with kind of a skeptical mind is a great place to start. And a good mental health practitioner is going to focus mainly on how you're feeling, what your understanding of the causes are, and how kind of together you can be empowered to feel better. So this often includes deep and honest reflection in a safe environment, more colloquially referred to as psychotherapy. So the therapist, again, who can be a psychiatrist or another mental health care practitioner, is kind of there to help guide you through that process. So, primarily therapy is kind of the focus. But sometimes a person can find it difficult to participate in psychotherapy or other behaviors like eating healthy or exercising or social engagement, like we were talking about before, that might help them, help to make them kind of feel better. So they might also be having thoughts or engaging in behaviors that are possibly dangerous to either themselves or others. In those cases, it can be very helpful to start a medication that will help the person to participate in psychotherapy, to re-engage in their life, and to give them a little bump to build healthier habits. In milder cases, people may take medications for a few months, and some people will choose to be on them for longer because of how beneficial they are to their overall happiness and functioning. And then there's also, in the case of severe mental illness, it can sometimes be advisable for people to stay on medications for their whole life. So, the timing of it can really depend on each person's situation.
Mm-hmm. So what you're saying is that medication can give one the boost so that they can more easily engage in the skills that one might need to learn through therapy. Is that what you're saying?
Exactly. Yeah.
Okay. What are some of the factors that lead to one developing mental health issues in the first place? Is it intrinsic or is it environmental?
Yeah, so, there are definitely intrinsic factors that lead to the development of mental health issues. So there are kind of biological predispositions, which involve, genetic predisposition, also certain medical conditions, as well as, substance use can lead to the development of certain mental health issues. There are also kind of psychological elements which have to do with how people relate to others and how people cope with stress. Then there are social factors, which are kind of what your environment is in and how that's affecting you and how that affects your ability to deal again with stress. And so that's what we call kind of the biopsychosocial model of the development of mental illness. There are also some things that people can do on an individual level, such as like eating healthy, staying physically active, and keeping socially connected, that can have an impact on prevention of developing mental health issues. But I would actually say that the most impactful preventative steps take place on kind of a family, community, and societal level. So there's this concept known as a social gradient. And this concept explains that when people have lower social status, they have a greater health risk. This is both physical and mental health risk, actually, and a lower life expectancy. So it also says that these disparities can be reduced by social and economic policies. Specifically talking about mental health, lower social status not only leads to increased risk of developing mental health issues, but also decreased access to services that might help people to treat the mental health issues. An important thing to note is that the impact of this can be seen across a person's lifetime and even across generations, some studies have shown. So factors that can determine social status are called social determinants of health. So these can include fixed characteristics such as race, ethnicity, sexual orientation, gender, It can also include factors that can change, like economic opportunities, living conditions, educational attainment, occupational status, housing, and also those social supports that we've been talking about. So what happens with these factors is they lead to what's referred to as chronic daily stress, which has a direct impact on mental health. So one thing to note is that while social determinants of health have an impact on mental health, the relationship is bidirectional. It goes two ways. So mental health can also increase the risk of some of these factors that we talked about, like homelessness, school dropout, marital instability, and economic insecurity. So given all this, the question that at least comes to my mind is, what can we do about this? And so the main interventions to date have focused on eliminating the systemic social inequalities that lead to these poor mental health outcomes. So this would include increasing access to education and employment opportunities, healthy accessible food like food stamps and like SNAP programs, things like that, secure housing. Many people within the area that I work in don't have secure housing, and it really adds to the amount of this chronic daily stress that I was talking about, and also safe neighborhoods. So trying to increase the safety in neighborhoods, and most of this involves putting resources into communities. Like I've kind of been saying throughout, the interventions have to focus on an individual, but also family, systems, and socio-political levels as well.
Thank you. That's very relevant, to what's going on today with,
yes.
I think it's come more to light. The problem has always existed around
yes.
systemic racism, and how that affects people generation after generation. So, the relation between that and mental health is very important. So thanks for shedding some light on that.
Sure, thank you.
Yeah. You were also talking about, when you were talking about this, you were discussing the relation between, I guess, our biology and our environment, and so our biology, our environment, and like, I guess, our own health. So can you speak a bit more to the relationship between, I guess, like physical health and mental health?
Sure. So, there's a couple things that I could say about that. One of them is that, some of these factors that we're talking about, there's a very famous study called the ACEs study, which stands for Adverse Childhood Experiences. And so they did in this study was they saw how many adverse childhood events or experiences that people had in early childhood. And then they tried to see what would happen if you have more of these versus less of these. And so, I think let's say if you had a parent with mental illness, or you were surrounded by substance use when you were growing up, or you had poverty, you didn't eat, you didn't know that your food was going to be regular and that you could eat every day. You witnessed domestic violence in your home. These things you could kind of predict that might lead to an increased risk of developing mental health issues over your lifetime. One of the things that came out of that study was that they actually found that not only did it increase your risk of developing mental health issues, but also physical health issues as well. So people who had more of these adverse childhood experiences were actually more at risk of developing heart disease, high blood pressure, high cholesterol, these types of things. So, mental health and physical health are intimately related in these ways. And in the same way that chronic daily stress that we were talking about can lead to mental health issues, it can also lead to these physical health issues. So there's that type of relationship. There are certain, another piece of it is there are certain physical ailments that can in some ways mimic certain mental illnesses. So psychiatry and psychiatric diagnoses, we always think of them as a diagnosis of exclusion. So the first thing that you always want to do is do a good medical workup on somebody before giving them, for example, a diagnosis of depression. You would want to make sure that the person had like a normal blood count, they weren't anemic, meaning that they didn't have kind of low red blood cell levels, which is the cell that carries oxygen in your body. You would want to make sure that their thyroid is working properly, because people with low thyroid levels in their body can also experience feelings of depression. And then actually when you treat those underlying conditions, their mood gets better. So that's always, that's kind of a more direct connection. And then, the third piece of this, what I would say is health conditions, physical health conditions can be very stressful in and of themselves. And so that can overwhelm people's ability in these same ways that we've been talking about chronic daily stress. It can make people more likely to experience depression, to experience anxiety, to feel kind of psychologically unwell because of the added stress from these physical illnesses. So those are kind of the three ways that I see the connection between physical illness and mental health.
Mm-hmm. That makes sense. Thank you for your insights, Suneel, and thanks for joining us today. I look forward to continuing this conversation on mental health in the future.
I as well. Thank you so much for inviting me to speak today. And, I really have so much respect for what you and your organization are doing. So good luck with that.
Thank you, Suneel.
Thanks, Maya.